Type 2 diabetes in males between the age of 40 and 50 residing in West Virginia. This is for class HCA 415. We are Team D, which consists of Ashley Remington, Stacy Sewell, Tiffany Smith, Brandon Thomas, and Michael Thelwell. Thesis. Approximately 8.3% of West Virginia adults had borderline or prediabetes. More than 1 in 10 West Virginia adults had diabetes and ranked West Virginia the highest nationally. The prevalence of diabetes was significantly higher among white, non-Hispanics, and Black non-Hispanics than among multiracial, non-Hispanics, and Hispanics. Type 2 diabetes is a chronic health condition that has the capability to severely alter your way of life. Men between 40 and 50 in West Virginia have had an increase in the case of type 2 diabetes, which is known as an insulin resistance. It is imperative that you change your lifestyle when you have type 2 diabetes. Unfortunately, it can go undetected. There is no known cause of type 2 diabetes, but lack of physical activity and obesity appear to be the common denominator. In 2010, age-adjusted prevalence was highest in Alabama, Mississippi, Puerto Rico, South Carolina, Tennessee, Texas, and West Virginia, and lowest in 12 states: Alaska, Colorado, Connecticut, Iowa, Minnesota, Montana, North Dakota, Oregon, South Dakota, Wisconsin, Vermont, and Wyoming. Assessment of disease. Metabolism disorder, high risk if obese, older, and have family history, may have no symptoms. Lack of physical activity helps lead towards diabetes. Strategies for awareness. CDC-led National Diabetes Prevention Program, programs that promote weight loss, programs that promote nutrition, and promote increased physical activity. Surveillance. Keep surveillance to help reduce amount of diabetic. Diagnosis keeps rising. Minorities and poverty help increase risk. Policy assessment. We will be discussing these next 6 topics for the policy assessment part. They consist of addressing the issue, specific community outreach, existing policies, policy development, identify stakeholders, and 3 essential services. Addressing the issue. West Virginia Bureau for Public Health created a project throughout the state. Many people not aware of being diabetic. Program helps people get healthy and be more physically active. Project brings awareness to community. Specific community outreach. The ADA and other organizations make suggestions to help prevent type 2 diabetes. Many health screenings recommended by physicians for diabetic patients. Primary physicians do same tests as others throughout the U.S. Existing policies. Implementing referral system for providers. Providers have presentation to show patients to create awareness on diabetes. Policy development. All men should have access to education on disease. West Virginia has limited access to information on diabetes for communities. Doctors educate, but many patients do not see a doctor regularly. And there should be free classes to educate men on diabetes prevention. Identify stakeholders. Dr. Robert D. Alessandri, elected spokesperson. He was a well-recognized leader. The Science Center was marketing, and Dr. Bob spoke about medical issues, which included diabetes. Guyton W. Hornsby Jr., also a popular leader in West Virginia. He was on numerous task force. He taught college courses on diabetes, and he received special training in diabetes. 3 essential services. Proper education, information, and empowerment. Communities want to be educated on the disease, and the committees have well-educated and experienced members. And that was it so far for our presentation. And these are our reference pages.